Hello, my name is Kara Canuck, and I am with Des Moines Mom. And today I have the pleasure of speaking with VaxiTaxi, and we have Casey Vilhauer. She's the pharmacist and CEO behind it, as well as Alma Michelson. She is a pharmacist and the director of pharmacy operations. So VaxiTaxi is relatively new to the area and to the market. Can you tell me a little bit about each of yourselves and VaxiTaxi?
Yeah, thank you, Kara. We're happy to be talking with you today. We appreciate it. My name's Casey. I am a pharmacist. I went to the University of Iowa, and then I've done some community pharmacy work, and also as faculty with the University of Iowa. And in 2020, we launched the company VaxiTaxi as a pharmacy service for delivering immunizations. It was good timing, but most importantly, it came about as my own daughter is very needle phobic. We needed a better way to get her own vaccines rather than the big hoorah of going into the pharmacy or into the doctor's office. So I have 3 children, and I live in Ankeny with my husband.
Awesome. Thank you.
Yeah, and my name is Alma Michelson. I am pharmacist as well. I chose to go into the retail setting myself too. So I worked as a retail pharmacist. I went to Drake University for my pharmacy degree. Currently, I work full-time with VaxiTaxi because I truly believe in this model. Again, as Casey said, VaxiTaxi is full licensed pharmacy where we go out into the field and give immunizations to patients, whether that be in their homes, businesses, soccer field. We both are moms, like she said. So I also have 3 kids, husband at home and 2 dogs. And sometimes life can just be hectic. And so having a service like VaxiTaxi to call and come to my house is something that is not there. And I'm glad to be starting it.
Okay. Tell me a little bit about VaxiTaxi and the type of services that you offer and the type of vaccinations that you offer.
Yeah, so our pharmacists provide all of the FDA approved vaccines for ages 6 months to 120 years old. So we have the opportunity to do those on site. We generally make our recommendations ahead of time if a parent needs another vaccine that, if you call for a flu vaccine, our clinical pharmacist can recommend other ones based on your profile if you needed those as well. But we do offer all vaccines, including COVID vaccines, and all 3 of the COVID vaccines as well.
And besides going to patients' homes, we also do on-site clinics at businesses, organizations. So whatever the needs are, if you'd rather have us come for to vaccinate the employees, that's something we offer as well.
Yeah, no, that's awesome. I know that lots of businesses offer, that type of perk to their employees where they hold on-site, locations, so they're not having to take additional time off to make an appointment and wait in line and to go through that whole process. So I think, yeah, it's a great convenience. I think additionally, you talk about having children that are nervous about getting a shot and seeing that needle. And sometimes, the comfort of a home setting can be valuable in making sure that a child does not have a complete, meltdown at a very public pharmacy in the middle of, a very loud room. So
yeah, we've experienced that sometimes it just takes one really simple appointment to ease all of their anxiety surrounding getting the vaccine. And, after they get one, then they're more, they're able to cope better with going to the office or going to the pharmacy the next time. So sometimes it just takes one really simple appointment.
Okay. So I know as we are heading into the season of the flu season, moms are like, okay, we know that we need to get our flu shot in. How do you go ahead and make an appointment and connect with you guys?
Yeah. Alma, you want to take this one?
Sure. So there are several ways. One, they can call our phone number directly, which is 1-855
Mhm.
VAX Iowa. They can also go on VaxiTaxi.com and click schedule now right on the home page of our site.
Mhm.
After scheduling an appointment, one of our pharmacists would call them back.
Okay, that's that's pretty easy. What areas do you serve?
Yeah, so right now we serve for all ages. We serve Polk County and the surrounding counties, so Jasper, Warren, Story, Dallas. Um, and we are working on some other areas of the state actively. So if someone has a question about whether or not we can contact them, the answer is most likely yes.
Mhm.
So we will get there. Another service that we offer to not necessarily a different service, but where we found that we can be very helpful is individuals taking care of like elderly parents or elderly grandparents. We are more than happy to bring their annual vaccines as well. And it frees up your time. It gives you the opportunity to have lunch with your grandma or your parents rather than taking them to the office for something like that.
Yeah, no, that sounds great. How far in advance are you guys booking appointments right now?
Yeah, so about 5 to 7 days.
Okay, no,
So we're
that's
pretty caught
awesome.
up.
Yeah.
Yeah.
Okay, so we've talked about who you guys are, what the type of services you offer, and how to get a hold of you. Um, so I know that there's lots of different things as far as preventative care, and I think with COVID, we've looked at a whole picture of the types of things. How can what part do you play as far as preventative care?
Yeah, we have a really good working relationship with a number of clinics and offices in the Des Moines metro, and so we really try to bring home the fact that we are very supportive of having like a medical home. So we are an additive service to your primary care provider. So we definitely advocate for just the very basic preventative care, which is have a routine checkup with your physician, and if you don't have it, then we're happy to make those recommendations.
Mhm.
And simple things such as drinking water, getting exercise, taking a daily vitamin, and keeping up to date with your immunizations. I think those are all very important parts of staying healthy.
Mhm. Yeah, absolutely. Um, Say somebody has a question about, the vaccines that you're offered, or they have a question about timing or side effects. Um, how do you handle those type of situations where somebody has a question?
Sure.
Yeah, go ahead, Alma.
So right now, if someone was to call 1-855 VAX Iowa, that's 1-855 829-4692, they can select clinical division, which they will get connected to a pharmacist who is a medication expert as well as an immunization expert, and they can ask their questions. The pharmacists are in a position to answer whether that's a question about timing or what recommendations that individual might be, what immunizations that individual might be missing.
Yeah, absolutely. I know that sometimes it's really nice to just talk to a real life human being and not just see what your Google doctor has to say. Um,
Right.
Another thing that I wanted to ask you about, you know, what do you have recommendations as far as children, and what types of things do you do to kind of ease like that process when you have somebody that's kind of scared?
Yeah. So we try and make it as easy as possible when our pharmacists are on site so that
Mhm.
there's not a lot of waiting and not a lot of like hype and build up. Because generally speaking, that's the worst part for people that are pretty shy around needles.
Mhm.
So we do all of that paperwork ahead of time, or as much as we can ahead of time, and the pre-screening questions ahead of time. So when our pharmacists are on site, they're ready to go. The actual shot itself is very, very quick. And we also have a number of like devices, pain devices, distraction devices, things like that, and some really fun rewards afterwards for their bravery and Band-Aid. So we have quite a few tricks for that.
Yeah, no, I think that's important. Okay, so just to recap, so can you remind me again of the vaccines that you offer right now to patients?
Sure. So we do offer all of the FDA approved vaccines, but the ones that we're really focusing on right now are COVID-19 vaccines, our influenza vaccines. We have some pneumovax, the pneumonia shots, as well as shingles. Yes.
Okay. This is a random question because sometimes I know like the shingles shot, like is that something you're able to do? Or I
Yeah,
know
we can also provide a shingles vaccine. With the shingles vaccine, right now it is a 2-dose series. And so we would provide both of those doses. They're given 2 to 6 months apart. And yes, that is one that we can also provide.
I know sometimes that one it comes up in conversation because if you've had shingles, you know that you never want to have shingles again.
That's right.
Right.
Okay, so my last question, we're kind of starting the whole flu season. What is the timing that you recommend for, parents as they're thinking about getting flu shots for themselves and for their children?
Yeah, great question. So the CDC recommends, similar to last year, getting your flu vaccine as quickly, as soon in the season as you can. So we can do the flu right along with the COVID vaccine. If you are 12 and older, we can do them at the same time, and we do them in opposite arms.
Okay.
So that is pretty important to note that you can get them at the same time. The earlier in the season, the better at this point, because we are already approaching mid-September. So that would be wonderful to just do them at the whole family shots at one time.
Yeah, no, just get it all done and then everybody can be happy and go on their merry ways.
Yes.
Well, that I think covers, the ins and out of VaxiTaxi and the type of services you offer and the areas of Des Moines and other surrounding counties that you service. One thing that we did not bring up at the top of this, but today, if you are listening in and you have a question, feel free to drop those in. We will make sure that our wonderful pharmacists here have a chance to respond to your question, either, privately through direct message, or if it's something that's not so personal, like a website or something, that they will drop that in the comments. Additionally, one of our viewers here for interacting and commenting, we are going to offer a free home delivery. So that means that they will be able to come out and give flu shots to your crew without having that $60 home delivery fee. So there you go. Well, thank you again, ladies, for your time today. I know that when we when we have to go in for shots, it's a big deal. And it would be great if it didn't have to be a big deal and it could be a lot more low key.
Well, thank you. Thanks, Kara. We appreciate that.
Thank you.